with a grant from the Jennings Foundation to teach a class that both taught environmental ethics and got kids, to do hands-on work with environmental stuff and medical ethics. We worked it out. It looked like it was going to work the first year. We taught Kevin Mattingly and I, some of you remember Kevin, who was a science teacher at the time, had a really good summer preparing it, and we taught it that year and we married it up with outdoor leadership. And so what the kids did for the environmental ethics part was to do an ecosystem study and then write about that. Then Kevin went to the mountain school and took the woods from the forest with him. And so I was left here in the hospitals, and I started calling doctors who were parents, doctors who were friends of the school, and started a medical ethics class. John is a veteran of that class, and he's going to tell you a little bit about it. The basic idea was twofold: engage the kids. No lecture. I didn't have no answers, so it was easy. And get them to hospitals, get them to sit with patients and with the doctors for that patient and discuss the case. In most cases, I don't remember which ones you did, John, but in most cases, the kids sat with the doctors, which was more than one doctor almost always, especially at the clinic in neurology, where they sat. Was it called Chief of Surgeons Rounds? Is that what it's called? Chief of something?
Chief Rounds.
Chief Rounds. Jack Conamy was head of neurology at the time, and he brought his doctors in and then wheeled the patient in, and our kids gathered around and mingled with the doctors, and he made them participate in the discussion with the doctors on the patient's fate, which was huge for a lot of our kids. So the idea was to engage them, and the idea tonight is to engage you. The 12 of you who voted pretty much voted for the same three, and happily these three people share those three. So we're going to start with John, whose credentials are up there, or about to be. John, class of '87, Hawken, and a wrestler and a football player. Jacob Scott, yeah, nice name. Also a wrestler and a football player. We're going to start with John, go to Jake, and then we're waiting for Deb Leisman. As I said, we'll see what happens.
So I have to take this opportunity to thank Peter for having that class. That started what has been for me a lifelong interest and part of my career related to ethics. And some things have changed in ethics, and some things haven't. I saw someone bring in a copy of Being Mortal, recent book. Ethics and it ultimately boils down to just because we can do something, should we do it? There's one of the beauties of the three different cases is they really hit three different areas of ethics. And one of the things that Matthew told me was that everyone does their homework, and a lot of people read the articles likely that I sent. So what I've decided to do is change the case and see, and then because these are, one thing about ethics that's also great is that there's many different disciplines involved, right? It can be theology, it can be philosophy, it can be sociology, it's many, but in clinical ethics, we have to make a decision about a patient, or in this case, patients, about what we do. So I'm co-chair of the Pediatric Ethics Committee at Rainbow, and we do have community members. So what I'd like to do today is empower you as my ethics committee, and then I'm going to need your help in deciding a case. And do we have the case up there?
Forward just one arrow.
Okay. So we have an 18-year-old pregnant female, and she's near term. She's doing a week, and she gets hit by a car, and she's brought into the labor and delivery, and they suspect a placental abruption. So the placenta is what basically is used to oxygenate the baby and provide blood. There's a lot of blood in there, both moms and babies, and so if it separates from the uterus, you can get bleeding from both the mom and the baby. So mom is being taken into the operating room, and the idea will be the standard sort of medical treatment will be to deliver the baby, give mom and the baby lots of blood to replace the blood that they've lost. but as she's being wheeled in, she says she's a Jehovah's Witness and she doesn't want blood for either herself or her baby. And so I've come to you to say, what do I do?
You have to give blood before you deliver.
You don't have to give blood before you deliver, but she is actively bleeding, and so the longer you let her bleed, the more likely she is to either die or sustain permanent brain damage.
So do you stop and you tell the patient, or is this, what do you do after you've told the patient you will certainly die?
For
If
this,
you don't do anything.
so with this woman, she is a devout Jehovah's Witness, and Jehovah's Witnesses, one of the interesting things about Jehovah's Witnesses is that they accept full sort of Western medicine. There's a religious group called Christian Scientists who generally reject modern medicine, but for Jehovah's Witnesses accept modern medicine, but their interpretation of the Bible is that they do not accept blood products. They believe that blood products lead to eternal damnation. So,
But just in terms of the question that you asked, if she's 18, that means she's an adult. So I'm guessing she has more power to make a decision for herself.
so
If she's due in 1 week, the choice she makes for herself would impact the baby. And then does she get a choice to decide for the baby whether the baby can have a transfusion, or is the baby's greater good getting the transfusion, and what the prognosis is for the baby to live?
I think you're hitting, that's the central question. Now, you read one thing, so legally, and one interesting thing is that law and ethics are different. So legally, the day you turn 18, she has legally the right. Ethically, it may be a little bit more gray, because we all know 18-year-olds are not always the most mature individuals in the world.
Can the baby be delivered without blood? I mean, without transfusing?
You could, now, your options are, you could say, these are basic options. We could deliver the baby and give the baby blood, but not the mom, and let the mom die and the baby live.
If you deliver the baby,
We're going to deliver the baby. The baby's
does
being
the
delivered.
baby have to have blood?
If the baby doesn't get blood, this baby will likely die, because the baby is bled out as well as the mom. Because the placenta is separated, so the baby's pumping blood into the placenta and losing blood.
Are there any laws in the state of Ohio governing this?
There are laws in the state of Ohio that generally you are not allowed to neglect your child. That's considered, it's.
But is it your
But
child?
what about you,
Or
though?
is it after?
What about you? You prohibited, if a patient says, I don't want this, are you prohibited from giving that to them? Or are you allowed to do that using your best judgment?
Well, the law gets a little tricky, because in the historically, and one of the things we're going to discuss in the additional cases is adults usually have the right to decide for themselves. So you are right that she is 18, and assuming that she's a competent adult, she should be allowed, the law would generally support that an adult is allowed to choose death over a treatment based on their religious beliefs. The law is also relatively clear that you are not allowed to make that same, in fact, it was the famous Supreme Court saying that parents are allowed to make martyrs themselves, they're not allowed to make martyrs of children. So the law would likely say that the baby should get the blood because the parent is not allowed to let the baby die.
What is her stress level to be able to make this decision if she's bleeding out?
I would think it's pretty high. All right,
So
so
is that an informed decision that she's making?
well, so you might argue there's when people make decisions like this, you might argue that she's not capable of making the decision because she's not. But in order to consent, even as an adult, you need to have what's called capacity, the ability to make the decision. You might argue that she's not able to make it, but in this case, I don't know that I think she probably is lucid. I mean, she's explaining her rationale, which lots of people who aren't bleeding out, there are plenty of Jehovah's Witnesses who say, I'd rather die than get a blood transfusion.
But who's able to make that determination, and if that's a doctor?
Usually it's a psychiatrist, but in this case, you don't have time.
Can you give the baby the mother's blood?
No, not time.
I mean, I think from the mother's point of view, of the central abruption, I mean, that kind of situation is obviously an emergency, C-section delivery. I mean, from an OBGYN perspective, it's kind of one, deliver the baby, two, stop the bleeding. So I think once you have, reached that point of view, you start doing your analysis of, does the person need blood? I mean, people at the kind of the head of the body are probably determining blood pressure, whether they need some kind of plasma expander or whatever. So, I mean, I think you have to, look at these as just two separate individuals. I think the baby has to be assessed individually, and I think physicians have the right then pediatricians have the right to make a decision for the baby, what's best in the interest of the baby. I think some of the cases we read kind of clarified that issue in actual fact, that pediatricians often, treat children until the age of 18 with blood products, because legally they're allowed kind of, they're court to do so. I think also kind of the whole 18-year-old thing, I mean, I think with the Jehovah's Witness, one really has to have that whole thing discussed way, by the time they're at least 15 or 16, that discussion has to be going on with the individuals themselves, and so that everything is in place when, when the decision is being made.
Sure.
I'll throw something at you. Full disclosure, I'm like, hey, we should be a society where people can make their own decisions, and if you're a minor, a parent can make your decisions. So that's where I would be. On the other hand, let's just say that you decide, okay, the mother can make the decision, and maybe you'll make the decision for the baby, maybe the mother will make the decision for the baby, and then a week later, the girl's parents step forward and they sue the hospital and they say, you guys out of your mind. And how does sort of the mothership of the hospital in terms of, well, I'm just working for this place, or, what is that relationship? And if I'm a parent who obviously loves my child, and I come in and say, are you serious? You thought this woman wanted to do this? I mean, she's screwed up or something. So how does that work into the reality of life?
Well, we have a defense lawyer who I think I say.
Well, I haven't taken these calls for a while. I used to take them in the middle of the night from the residents down at University Hospital. And almost always we had a judge on call for exactly this situation. And we would get a guardianship order in the middle of the night.
What's that mean?
In order for the hospital to take guardianship of the child. And they would release their blood.
You have to wait till the child's born, right?
They would, the fact pattern is you're going to deliver the baby. The baby's got to be delivered right away. So you deliver the baby. You get an order from the court that you can give blood to the baby. And I think that most judges would not step in and require treatment of the patient or anything like that.
So that's the pretty good summation of what generally the law would do. And then the question is that ethical?
Right.
Is that the right thing to do?
And as I mentioned before, if it's somebody's religious belief, why shouldn't we honor that as physicians, as a medical community?
In Indiana,
Because we live in Indiana.
Well, honor beliefs for herself or the baby or both.
Yeah, what if she were gay?
Father.
is there a father?
We would let her in the hospital.
Would she get treatment?
Is there a father involved?
There unfortunately, as you know, a lot of times when people get hit by a car, there's no family around and we don't have time to consult in the cases that you read, or if you didn't get a chance, there are parents, and one of the concerns with 18-year-olds and their parents is whether or not they feel they're being coerced, or whether they feel pressure from community or family to say, I'd rather die than get the blood, but really they'd rather get it.
Are the ethics as much for the patient and the patient's family as the doctors?
I believe it is, because to me, having treated many 18-year-olds in residency, some are very, very immature and they may not really know. On the other hand, some are. I mean, maturity when you're 17 and a year, and it doesn't mean the day you turn 18, you have this magic ability to be mature. That being said,
Just to help you deal with the day you decide to choose to die, to help you move forward.
well, if certainly for physicians in these positions, in the old days, they would say, in fact, some of the earlier judge decisions would say, you have to get the transfusion because you're going to distress all the healthcare professionals for violating their moral beliefs. but they also said things that, well, also you have children and you can't die because you have to take care of your children. That's been discredited lately because people, that takes autonomy away. Most people in this country believe, I think what you said before, that if you're a competent adult, should be allowed to decide what happens to their body. So when you start saying, well, we're doing this to make the doctor feel better, things, is that sort of your point?
Well, I mean, if someone is going to choose to die, the physicians who have been trained and brought along to value and help life and do no wrong, you've got to deal with that as well.
We
So
do.
the ethics there to help you make the decision either way or move forward from a decision?
Maybe. I mean, I certainly feel we do try and train people now to respect autonomy, and certainly there's in fact, there was a very high-profile case in Oregon of a woman, Brittany Maynard, who moved to Oregon so she could take prescribed drugs to assisted suicide. There are physicians out there who will prescribe drugs to a patient so that they may take their own life. So, 3 minutes?
I'm opposed to
Oh yeah. Okay.
Amy Gurnitz is logged in. She wants to know, and I think you've answered this, but is the life of the baby more protected than the life of the mother?
Is the life? Yes, to the extent that the law protects that if a child is in a life-threatening position, that treatment should go forward.
Does it matter at all the outcome of treatment? Like, in other words, hey, just get a pint or two and you're good as perfect, as opposed to, you're going to end up with brain damage and not live a whole life, or it's going to be, the outcome is not good. Does that factor in at all?
I think for most Jehovah's Witnesses, if you get 1 drop of blood, it's as bad as getting 5 gallons. So I don't think that matters. Yes.
We had a case, and you may have been in this class. We had a case I just told Sally about. We had a 17-year-old boy who was adopted by Jehovah's Witnesses, who needed heart surgery, and we went down and visited with him, and the kids were all 17 years old, same age as the kids. And they said, well, what are you going to do? And he said, well, I can't do anything. I'm not 18 yet. My parents say that they can't transfuse. And so we thought, he's gone. We came back, they brought the little, in those days they were called cassettes. But we came back with those, and the kids spent some time with him. And then after it was all over, I called the doctor and I said, so what happened? And he said, he's fine. And I said, did you transfuse? And he said, he's fine. So Bob, would you Bob would judge on this one, and probably maybe got a legal wage?
I mean, I assume most physicians in the presence of parents who are saying you cannot transfuse our kid, would not simply go ahead and transfuse without getting an order from the court. But I don't know what currently the.
Maybe in the 80s.
No, first of all, it depends. The reason I created this case this way is because I wanted black and white. The babies need transfusions. There are cases where it's not quite as clear, and in those cases, a judge may side with the parents. But in this case, it needs to happen. Yes.
It's just very interesting that I'm just thinking about something that I've been dealing with. I'm a therapist, and I'm seeing a young woman who's 19. She and her twin were premature at 25 weeks. The twin died. They didn't make an effort to save the twin. They did make an effort to save her, and she has some neurological problems, severe learning disabilities, fine motor problems, and in deciding what is in the best interest of the child, she kind of feels angry that they didn't let her go, because now she has to live with all of these issues, and it makes her life very challenging. So it's just kind of an interesting question in terms of
That was kind of my.
Yeah.
So
Does that factor in at all in the decision making?
I mean, not in the emergency room but in sort of more chronic cases, it usually does. And I'll tell you, some people feel that way. There's certainly plenty of preemies who tend to argue the other way, that their quality of life is a lot better than we make it out for. I always use the example, Christopher Reeves literally was Superman, and then he became a full quadriplegic, and most of his quotes are, initially I wanted to die, but I adapted, and overall he became an advocate, and I think it was a different life than he expected, but there was still, he has quotes saying there was still love and pleasure in it.
And he had financial resources,
Well, that's true.
Yeah.
I do. I have a question. Did they tell the parents that they transfused the blood?
Yeah.
Was that
Don't ask.
Most,
Could they sue the hospital?
well, I don't know how much that's done anymore. That used to be, now in
That was 30
Western,
years ago.
Yeah.
Only if the child actually went to hell from it.
yeah.
Hey, one had some sort of exorcism or something.
Right. I mean, in Western ethics, you would say no, that you're supposed to. But I'll be honest, in other countries, they look at what we do and think we're crazy, and they will not tell a grandparent that they have cancer. They'll let them. They'll say that's our burden, not, So in an autonomy-based world, which is what we are in this country, you'd say no, you have to tell them. But the other theory is that if you tell the family, I know you don't want to transfuse and you're not going to sign this consent, but I get this court order, at least they don't get excommunicated from the church. The church doesn't punish them for violating their.
And then I would think it also would be an issue of when do you tell the parents? Do you tell them, I've got the court order, I'm about to give the transfusion, or I gave the transfusion?
I usually will be honest with the family and say, this is what I'm legally required to do and ethically required.
How about full disclosure? I mean,
Full disclosure
in other words, if they, 30 years ago, it wasn't full disclosure, or it may not have been full disclosure of telling the parent that they should transfuse that child.
Well, that's part of the reason why nowadays you would, but in the other, that was a more of a paternalism type view, right? I do what's best for the patient, and I try and take burdens off of the patients.
But there is some interest in law that there are no damages. Life is a value in and of itself for which you cannot take damages if you are permitted to live. So.
So you want to take a vote, Pete? Can we take a vote?
Wow.
Say that again, right?
If they die,
If they die, you
but
can damage.
if they're given blood, if they're permitted to live,
That is true.
then there's no damage.
Well, what if the wife is medically funded?
I mean, the law in Ohio is that, and it comes up in the context of if you're a woman and you're having a tubal ligation, and you get pregnant because the tubal ligation was improperly performed and you give birth to a baby, is they want to get damages for having to raise a kid that they didn't want to have. Courts have said there are no damages. The quality or value of having a healthy child is not damages. That outweighs the expenses of raising a kid. And that is also true if you have a child who is born with any type of physical damages.
So
quality of life in and of itself exceeds expense associated. That's the law in Ohio.
So Bob, does that mean that if he did transfuse the 18-year-old mother and she lived and she found out she had a transfusion, that she could not sue?
I think she probably would have a very tough time if she lived and had no health consequences from it. I'm not sure that there are damages there. I mean, Jonathan, what do you think?
Well, I know we're running out of time, but first I want to get a vote of what people will tell me to do, and then I'll tell you what will happen usually. So there's 4 choices, remember: transfuse no one, transfuse everyone, transfuse, I don't think anyone's going to choose to transfuse just the mom, but transfuse the baby, but not the mom.
Fine.
So
How many?
which one?
Okay, we'll do no one.
Most people?
I transfuse. Yeah.
Transfuse both.
You can take it.
Or how many of you would transfuse both? All right, so about 5. How many of you would transfuse just the baby? Okay. Anyone would transfuse no one? Okay. So basically both the law and the ethics are relatively straightforward for the baby. The baby would get a transfusion based on the principle that the baby is the right to make their own choices later on, and that is clearly the best interest of this baby to survive. And in this context, you wouldn't have time to get a court order, so usually what you do is you would try and get a second opinion quickly, or you would just do it. That's what would happen. For the mom, I think it would probably be 50-50. I think that some people might let her die. Actually, I think it would be more like 70. I think most physicians would bring up, I think you had mentioned, someone would say she's too stressed to make this argument. I don't really know in this emergency context what the circumstances are, and they would probably go ahead and transfuse and think, you know what, sue me if you have to. That's what usually would happen.
I just couldn't let an 18-year-old, a healthy 18-year-old just die.
Right.
Yeah, we're gonna move to a 26-year-old. And John and Debbie, you guys chime in.
Okay.
Please do.
So 26-year-old who had Hello Kitty teddy bears and pillows with her, and who did not speak to her physicians, and we spoke only to mom, and who probably had either borderline personality disorder or schizoid or schizotypal personality traits. So a 26-year-old who felt a lot more like a pediatric patient than I've ever taken care of in my life. Presented to my clinic with badly managed and also overlooked cervical cancer that was about the size of a softball, so 12 centimeters or so. She had been in jail for her boyfriend had been busted with a bunch of painkillers, and she was in the house, and he blamed it on her, and she didn't speak up for herself because probably of underlying psychiatric problems. She was sentenced to a year in prison, which she missed her first pap smear. She came after she got out back to her mom's house. Her mom sent her to the doctor. They found a massive cervical cancer. She went to an outside hospital, which when we say it like that means a bad hospital, in the middle of Florida, and was managed by someone who has 83 more days of training than me, which is to say it finished a day previously, and was managed improperly. She had diarrhea during the course of her chemotherapy and radiation, which was not managed at all, and so she had a break in her chemoradiation, which portends poorly for cervical cancer patients. At the end of her chemotherapy and radiation together, all cervical cancer patients have to have a completion therapy, which is called brachytherapy. I'm going to show you some dumbed down pre-dinner versions of what you might see. So Matt, show the next picture. This is a patient with a leg cancer, which is a lot easier to look at before you've eaten. So this is a patient who had a cancer removed from their leg here, and then we placed catheters across the wound. So you see those little straws? Those are little catheters that we placed across the wound. They're about this long. Imagine those instead placed through the labia and into the vagina, up into the cervical cancer. So this is not a trivial procedure that we're doing to this young woman or proposing to do. This is done in the operating room, and for her, she had a worse response than we expected. So we didn't really fully expect our treatment to be successful, but at the same time, we offered it to her as curative therapy. In the preoperative period, we further did a liver scan because we had some worries, and we found what looked like metastatic disease, which in cervical cancer portends something like a 9-month to 1 year life expectancy with no cures. We have no good chemotherapies for this disease once it's spread. So we were faced with a situation of offering this woman very invasive therapy, which if she didn't have liver disease would be curative. This means we knock her out, we put her to sleep, we put 15 or 18 of these catheters this deep through her most sensitive parts, and leave her in the hospital with that device in place for 4 days while we give her radiation therapy over the course of this period, and waking up to an uncertain future. The patient didn't speak throughout the entire period. We didn't have the answer about her liver lesion as to what it was, and we were worried about her blood counts because of her chemotherapy. And so we were faced with the decision of waiting another week, during which we were going to obtain a biopsy, get an answer, and then make a decision, or trying to complete the therapy within the 8-week window, which has been shown in the literature to give you your only chance of cure. So let's start there.
Can I ask why she didn't have surgery?
Surgery is not the mainstay for locally advanced cervical cancer.
And what did you need from her? Exactly.
In this situation, it was a decision about what she wanted to do, but she hadn't uttered a word to us.
Was she able to utter a word?
Yes, but she was capable, but if you asked her a question, she would look at mom.
How long was her RC?
She had 5 weeks. She should have had 5 weeks. It was broken up. It was more like 7.
Jake, what's the point of these catheters again?
You put, next slide. You put radiation inside them. So look in the upper left corner. This is again the leg that you just saw. we put radiation like sources inside of them. Yeah, and it lets you get a really high dose to the tumor, which you couldn't get if you were putting it in the outside. For cervical cancer, this is bog standard. If you have really bad cervical cancer.
Jake, what was the status with family members again?
Mom was there, stepdad was there, and a sister was there. Mom was super cool, very on board, very on top of it, happy to have her daughter back from what seemed like an abusive relationship and then prison, and was all about being helpful. She was great, no question at all. But the question was, this is now an adult, so should I even talk to mom?
Was she capable of thinking like an adult?
Yeah, was there a psych evaluation?
We had psych come for, in the reality, we had psych come to help her with coping, but we actually didn't evaluate her. We maybe should have. Coping.
So when you say that this would be a cure or within 8 weeks, is that true that it would actually be cured, or is that a hopeful
25%?
25% cure rate?
Without the liver lesion.
Is this, you mentioned being more of a book, and having conversations with the family and saying, do you want her to go through this stuff, or do you want her to have a peaceful and more quality of life to a death point? So, does the family, I know you're saying, you want to talk to her, not the family members, she's an adult, but obviously she's not capable, she's not going to tell her little kitty this stuff. So does the family meeting have some meaning there and some weight as far as decision making?
I don't know, should it? I was very torn between asking the parents to, this is a young woman who, I had no idea how to approach this. This is 2 weeks ago. I had no idea how to approach this young woman. So I just talked to mom. But I don't know if that was right. So I'm asking the board.
Isn't the actual emotional or psychological maturity of someone more important than the chronological age?
This is exactly the point of the last case, right? I don't know. I did the right thing by the law. Or no, maybe I did the wrong thing by the law. I did the right thing that I thought should have been done in the situation. And I didn't get any sort of external consult. And I don't think it'll come back to bite me. But
What was the downside of not doing it?
Not doing it. So this young woman's going to die this year, for sure. No matter what I do. So she'll either die from disseminated liver and maybe bone disease, which would suck, but it might be painless in some ways, or it might not. Or she would die from a tumor eating through her abdomen, originating in her cervix, which would likely be painful and cause infection and not be much fun.
I think what you're getting at is that I think that book is excellent, but basically, if I ask most of you, how would you want to die? Most of you will say, I'd like to be surrounded by family and my pets on a beach watching the sunset with a beer. Okay? When you look at how most people die, they die in an intensive care unit with people they don't know and lots of tubes and wires shoved in them. And so that's a little bit of what the choice.
What about the pain management? Would it be better?
Either way, we can manage pain. We're pretty good at managing. We're pretty good at managing.
What kind of quality of life do you think you've given her by offering this particular procedure?
So I personally think we did the right thing, because I think that having a suppurating infection in your abdomen originating in your vagina would be a bad thing when it comes to being able to interact with other people. I've seen someone pass that way and no one even came to visit by the end because of the smell. And so that's a difficult way to go. But at the same time, she didn't have much fun during the 4 days we had her in hospital. And I haven't, in the 4 or 5 days afterwards, there's recovery period, which is quite difficult. And, she might have had more complications than she did. And she actually happened to do quite well during the procedure, but that wasn't a given by any stretch.
But you gave her quality that she could.
We did, but that wasn't a guarantee. This was a much bigger tumor than we've ever implanted. It was that's called an implant. A much bigger tumor than we've ever implanted. We weren't certain going in that we're going to be able to do it effectively. It was based on sort of the skill of the operator, and we ended up doing well. But, yeah.
I think what sounds very challenging there is trying to weigh up the pain level on the one hand, this is going to be very painful in the short term, but is it going to cause a lot less pain than, the infection that you're talking about? On the other hand, okay, maybe she wants to die surrounded by her family, in which case maybe we don't do this, but then she has a lot more pain. So it seems difficult to sort of ascertain which is the less traumatic way to die, which is basically seems to be the question.
Yeah.
And I read a very interesting series of articles in the New York Times some time ago about cancer and doctors. And what came through really clearly was that the doctors themselves would choose to die, and a number of them did have terminal cancer, would choose to die in the hospice. But so many patients are pretty much forced through the whole painful last survival. And I just found that extremely interesting. How come patients aren't maybe advised to take the slightly less traumatic route?
Oh, I think your use of language is very interesting there. You're saying that you're forced to, as opposed to demand. I think that's.
And there's a difference there. It's just how it's presented. I mean, I like to solve problems.
Well, I mean, I think how it was presented by the doctors who were suffering from the terminal cancer was that their patients didn't have the advantages of their education.
That's actually really happens a lot, actually. And one of the things is actually how illness is portrayed on television is how people think about it. So if you look on TV, 90% of people survive from a COVID. They die in the hospital. Or if they come into the hospital, if they had a cardiac arrest. In the hospital, in reality, 7% of people will survive.
Really?
So doctors know that. We know that because we see that. So you ask us what we want done? Actually, my daughter just called me. She's taking a public health course, and she needed to ask me my advanced directives, what I would do. I said, don't do anything. Don't intubate me. Don't do chest compressions. Don't do anything. She said, why? I said, because I know what happens. But so that's the reality, and that's what people see on
The
television.
joke is you get to, once you finish medical school, you get a DNR tattooed in your chest.
Or your uvula, right? Your uvula.
DNR.
One of the most heartening things my son ever said to me after he finished med school, he said, don't go to the hospital. You go in sick, you come out dead.
And that's unfair because it is our bias because we remember the bad stuff.
But I don't know if any of you read Ezekiel Emanuel's article. Was it in the Atlantic? Was it in the Atlantic? He said when he's 75, he said a great life. Ezekiel Emanuel is the brother of Rahm Emanuel from Chicago.
Oh, yeah.
He's an oncologist. And he works at University of Pennsylvania. And he said, when I turn 75, I'm going to stop going to the doctor. I'm going to stop getting blood tests. I've had a great life. It's okay. I've had a wonderful life. He just climbed some mountain with his nephews. He's like 60 years old or 64 years old. And he said, I don't want to keep on prolonging this for something that's not going to do well. And it's actually a great article.
That sounds a bit like kind of the 80-year-old, now it's an arbitrary kind of number.
Yeah.
75 is kind of.
But it is an arbitrary, exactly, absolutely. So that was another pick. So I'm just using his numbers.
And that brings up the whole idea of death with dignity and euthanasia and the right to make those choices.
Did the mother have any quandary about having her daughter treated?
No.
And what if it would be very different if the mother said, absolutely don't treat my daughter?
Well, so
then you would have had a real issue.
That's right, and I was even thinking about the opposites, which is the fact that the mom and stepdad were like, go, do it. You're the experts. Do what you think's right. Do this thing. But I looked over and I saw in the bed or the chair this scared girl, and I was afraid to send the parents out and ask her what she wanted because I thought she was going to say, "Don't help me. Don't do anything. I can't. That sounds too horrible," and I didn't do that.
So what would have happened if she said, I don't want you to do anything, I just want to die? What would you have done?
I don't know.
Yeah, but aren't you, that goes back to the wish of the patient.
It does. I would have liked to think I don't know what would happen. I would have called a eval or a board or a lawyer and asked and gotten consent because I wanted because I wanted to give her this thing because I didn't want her to die this way, but that's me. I shouldn't really be the one deciding.
How would you feel if that was your daughter?
Yeah, or if
I don't want to.
or if I'd killed her with the procedure.
Let Can I ask, what you had said that you're able to manage pain? Isn't that also for the treatment for the 4 days that she had to have those rods? Couldn't you have? So in other words, as gruesome as this completely sounds to everyone in this room, aren't you also able to manage that pain as well and not just also just dying?
Absolutely. I mean, she was pretty well snowed for those 4 days.
Yeah.
But 2 times I went to visit her, she was crying. Whether it was emotional pain,
Right.
having me and 4 other people looking at her private parts with 5 other people in the room. She was bleeding actively. We were transfusing her. There was no issues there. But I mean, it's embarrassing and it's hard. And so I could give her opiates.
Right.
I could make her physical pain go away.
But you don't want anyone to die of humiliation.
No, and I want her to experience as little as possible before
Right,
that.
but yeah, you're absolutely correct.
I have to say, I don't know about other women in the world, but I don't think all parts of the body are equal and should be valued equally. And, just because you're a doctor and you want to save my life, I don't know that I would say, when you're talking about that part of my body, go ahead and do whatever is necessary. It's weighted differently. Absolutely.
Yeah.
I mean, I'm treating that whole area. I mean, pelvic pain is horrendous. I mean, everyone who's got, people with men with prostate cancer, people with pelvic cancer that has a growth in that area. I mean, that is, affects your bladder, it affects your bowel, it affects everything. So, I mean, I felt, the woman sounded like she truly needed a guardian, that she was incompetent, obviously her parents would be her guardian. Now, if I'd been her mother, I would have said, yes, I want this treated to reduce the tumor, if she's going to die, liver metastases sound much better to die from than a huge growth, something growing in your pelvis. It's just really, not just pain, but, affecting bowel, affecting bladder, just horrible. I would think, so I actually wouldn't have had any qualms going where you went and say, look, this treatment, we can't guarantee, but this is the best we can offer. And, let's go for it. I mean, she's 26, let's go for it. You don't even know if that's a liver met.
Well, and that was the thing. We didn't. I guess the big question that still hangs on me a bit is, and I now know that it was a liver met. So, that's one thing I didn't know at the time. But should I have called in a consult to see if I should have let mom make the decision for her?
There was a program on PBS this last week, and it's about, I don't know if anyone's seen it, but it's about cancer, the emperor disease. And, there was a part of this movie where, this documentary, women in the 70s were told that there was a drug that would cure breast cancer. They picketed, they banged down the walls of the pharmaceutical company. They said, we want this stuff, we want to live. Well, it was still in the testing phase, so they couldn't give it to everyone out there. So 10 years later, when they got the real data, it didn't work. These women were not cured.
What was the drug?
Herceptin. It was also bone marrow transplants that they were trying to.
So, and I think that our society and our culture is so gung-ho about we're going to cure cancer and we are curing cancer. And I can tell you, you're saying 7 come out of a cardiac arrest. How many go in and have cancer? And we all say, I'm a survivor. I know many people that are survivors. But the fact is there are a whole lot that are not.
And they don't talk afterwards.
No, and they have nothing to say.
Yeah.
They're not here anymore.
Yeah, there's no survivorship market for them.
Right. So I think that it's really important that the consumer, the patient, as well as the doctor.
Is that what a patient is? I'm just I think it's a good question.
I think it's providing service.
Sure.
For patient, right?
But I don't think that was what a doctor was 100 years ago. Or 50 years ago? I agree with you now, because I was trained, but I think that's a valid question.
Well, the doctor used to come to your house years ago. Dr. Towel had hands up to here. I had chickenpox and he came to my house, you know?
Plastic pin guard.
My grandfather, I remember going on house calls with my grandfather, he was a doctor, and he would go in and he would see about 3 people.
In the same house.
Yeah, in the same house, that's exactly right, and I remember that.
And we're lucky, Carmel, we didn't get leeches.
Exactly, and he got made with, fresh grown vegetables in the backyard.
Sorry, I gotta jump in. The data also showed that your chance of benefiting from that interaction was about 50/50. So it was nice they were there, but that was what it was.
You know, I think what you were saying there too was, you know, even though she had metastasis to the liver, when you were evaluating, I think it sounded as though, based on your experience, she would have a much less painful death from the liver metastasis than she would have on the abdominal.
Yeah.
So.
That was my judgment.
Yeah, so if you're looking at it in terms of, you know,
Quality
quality
of
of
life.
beneficence, that was the, you know, the equation.
Yeah. Unless she died from the procedure or complications therefrom, or.
She would have been,
But then the
and she would have been, God would have been
Yeah.
and that wasn't what you were going for. You weren't going to kill her. So if you were doing the right thing.
I never do, mind you.
Doing the right thing, the consequences.
Yeah.
You know, ethically speaking.
I think the ethical quandary is in whether or not I should have let mom speak for her.
Well, if she wouldn't talk to you, wouldn't say a word, then why shouldn't you speak to the mom? I mean, somebody's got to talk.
That's what I did, but she's 26. Should I have asked mom to leave?
Yes.
Would she have talked if the mom had left?
I don't know. I didn't test it.
I think there's a difference in chronological age and the ability as an adult to make a decision. And it doesn't sound like she was capable of that. She kept looking to her mom, and she should have given her.
There's a lot of codependency a lot of times happens when there's a witness to that codependency. And when I have a counselor background myself, and when you get rid of the witness, you get a different person. You get a person that possibly would have said something very different to you.
Yeah.
And there's also.
I'm not going to sleep tonight. Thanks for that.
No, but then, there is a concept that, let's say she's not 26 with her mental age, she's 16. But there is a concept called assent, that even though you can't sign the form and consent legally, that you should be able to make decisions for yourself and that you have opinions on it. And so it may.
Assent.
A-S-S-E-N-T. So that's a big thing, especially for, you know, you have a 17-year-old or 16-year-old with cystic fibrosis they've lived with their whole life, or Crohn's disease, or other very chronic type illnesses that can be life-threatening.
We're going to move to Jeff.
Wait, hold on. Should I have asked the mom to leave? Raise your hands if yes.
Leave.
To leave.
Shit.
Ask the other question.
Did I do the right thing?
Yes.
All I can say is if I had a daughter like hers, I'm sure we would want to. And I would want to absolutely, because I would be scared of what she would do or say that she didn't have. And I'm a mother of like 7, so.
Yeah.
And you left some stuff off.
Like 7 or 7?
But you also gave the mother and the daughter
We're
more
gonna
time together
move
when they had been
to
separate.
Jeff. And I wanted some of you heard this, but I was Jeff's teacher in high school, and Jeff was Jake's teacher at med school.
So all goes around, eh? Sarah?
As was Jonathan, by the way. I also rotated.
Just want to say, just because I can't not say this because I'm a general internist, is just epidemiologically, most people, women who have cervical cancer in Africa from HPV will die that kind of death. It's like a 40–50% death rate. I mean, so it's really common in Africa to die from that. So HPV vaccine in the United States is really important.
Boys and girls.
But you saved that 82-year-old who I went with you for 3 weeks.
Same procedure.
Same procedure.
Yeah.
So.
Well, just head and neck cancer, anal cancer, cervical cancer,
HPV.
all HPV. No, it's not just cervix. It's anal, it's head and neck, tongue, base of tongue, all over the mouth. Get it for your kids and grandkids.
Yeah, give it for
Boys and
kids.
girls.
Boys and girls.
Boys and girls.
And his insurance covers it till 26 and girls.
So why are they giving that to adults now?
Because you already have it.
Oh.
So do I.
No, actually, even if you've had it, you should still get the vaccination.
Because the strains.
Because they're different strains, and not all the strains actually, the vaccine is not perfect. There are many different strains of HPV, and the vaccine doesn't necessarily cover all the strains, it just covers some of them, and not even all the ones that cause cervical cancer. They're still trying, they'll make a better one.
Should men and women get?
Yeah, boys and girls.
No, I mean men and women, adults. Okay.
They won't pay for it, insurance won't pay for it.
Insurance won't pay for men.
She had it before she got to me, she had it, yeah.
Is there an expiration date that if they,
We usually say by 26.
no, what I mean is that they were given it.
No, at this point, you don't get a booster. You don't booster. But we only had it for about, as a vaccine for about 10 years, so we'll see if titers start to wane. So we'll see if it can start to drop off. But at this point, there's no indication for a booster. So. Just had to put that plug out with cervical, sorry. I'm a preventive doc. So this case is not my own case. I looked this one up online for great ethical cases, but I am happy to talk about it. Okay? So I suspect you already read it, so I don't know if Jake didn't read it, but I'll read it again. John, a 32-year-old lawyer, had worried for several years about developing Huntington's chorea, a neurological disorder that appears in persons 30s or 40s, resulting in uncontrollable twitching, contractions, and progressive irreversible dementia. It typically leads to death in about 10 years, 10 to 20 years usually. John's mother died from this disease. Huntington's is autosomal dominant, and children of an affected person have a 50% chance of inheriting the condition. John indicated to many people he would prefer to die rather than endure the progression of the illness. He was anxious, drank heavily, and had intermittent depression, for which he saw a psychiatrist. Nevertheless, he was a productive lawyer. John first noted.
Par for the course.
John first noticed facial twitching 3 months ago, and 2 neurologists independently confirmed the diagnosis of Huntington's. He explained the situation to his psychiatrist and requested help committing suicide. When the psychiatrist refused, John reassured him that he didn't plan to attempt suicide anytime soon. But when he went home, he ingested all his antidepressant medicine after pinning a note to his shirt to explain his actions and to refuse any medical assistance that might be offered. His wife, who did not yet know about his diagnosis, found him unconscious and rushed him to the emergency room without removing the note.
Without removing it.
Without removing the note. So you're in the emergency room, what are you going to do?
Well, there's no, well, it's not a legal DNR.
Ship him to Oregon.
That's a problem. To make sure that the fact is valid and that, his wife hasn't just sort of slid these arms and continually tag his
So, you do have to, I think, maybe ignore that note. I would think.
Or if it was a tattoo?
Yeah.
That's the lawyer, he has a defense right. Oh, that's in order.
Right, we're gonna send them the girl saying, I'm a Jehovah's Witness, don't treat me. And he's got a DNR, what's the difference?
Yeah. But how do you prove that that's his handwriting, that that's his?
And to whom do you have to prove it?
What if she called his doctor
Psychiatrist.
to find out?
I think this guy really needs to, because I think we need to resuscitate him and let him reconsider and talk to people, and then kind of suicide again, because it has directives and,
We learned he can't sue you for damages if you do that.
So one interesting thing to think about here is that this is in Ohio, right? And that when we talked about Oregon, that Oregon is not Ohio. And that actually only 3 states out of 50 have actually have assisted suicide law. And they're all, I think it's Washington and Vermont, maybe.
But this isn't assisted suicide.
Well, it's not. But if you start to say, this is what he's trying to commit suicide, and you start to say, how do they look at, if you were going to say he's allowed to commit suicide, what kind of steps would you take to, because I think what people are saying is, how do we know that he really wants to do this? And so if you look at that as an example, they require a couple of things. They require a couple of opinions. They require some time. They require psychiatric evaluation. There's sort of protections built in that don't seem to exist here.
Okay, here's the deal. The wife knew his wishes. The wife knew about his drinking, she knew about his depression, and she knew his stress and his worry over this developing this disease. She brought him to the hospital.
But she didn't know
She didn't know
that he
that
actually
she
had.
Irrelevant, I mean, this pinned on, trust me, if I ever saw if I knew everything that I just said about my husband and I just saw this pinned on, the question really, the ethical question is, do I call 911 or do I
Let him die.
let him die? Because once you call 911, now, now it's.
There is the issue. There is the issue I was just bringing.
It's her wish, not his.
There's a wife that has to make a decision.
She
Whether
should
the guy is going to.
That's
die or
exactly
not
right. It
die.
really was an ethical question for his wife.
Actually, there is another
But she
question.
She had been
hunted
in legal bind, if she essentially let him die, and someone did, an autopsy, it turns out actually he might not have died, and she
What if she didn't go home?
Right.
Yeah, that's hard to
There
prove.
actually, there is another issue here, is his depression.
Yeah.
Because there's a good data to support the people who are depressed, who attempt suicide, who survive, say, I didn't mean to do that. And that's actually guns, and if you want to have a gun law, I don't know where everybody sits on this, but one of the arguments against guns is one of the highest crime rates of death from guns is suicide rates. Because you have this impulsive feeling like you want to kill yourself, and then you have a very effective means. As opposed to if you didn't have quite as an effective means, you can change your mind, you can go back, you can get back and realize, I didn't really need to do that. But a gun is pretty, it ends things,
They've actually interviewed people who jumped off the Golden Gate Bridge
Yeah.
and who survived, and a number of them say, the second I left,
As soon as I
left, I was like, what am I
As soon as I was
thinking?
running down, I was
I
thinking,
changed my
what
mind.
the heck was I doing? So, and that's depression. That's actually depression. So that argument here is that this guy was really depressed, and he realized he was going to have Huntington's career, and his depression wasn't adequately treated. And so that you can argue in terms of.
But he'd still be a lawyer.
In a sense, how does one assess whether somebody who may have some horrendous life-threatening illness, how does one assess whether their choice to want to die is depression or their choice to want to die is a rational decision based on their illness?
I think it's hours of questions with a psychiatrist dissecting apart very similar appearing psychopathologies.
And
Yeah, but
actually,
his wife had to know the answer to that.
absolutely.
And he didn't, I'm assuming he just didn't say, I want to die when he was in a depressive state. He probably said this over time, so.
Right.
So when I said to my wife, true story, if that ever happens to me, don't resuscitate me. And she goes, no problem.
Which one? Which one are we doing?
Well, both of them. We having two pillows.
So once he's in your emergency room, you have to resuscitate.
That's the
Do you?
thing that we have to change about advanced directives, I think, in our country. And actually in Europe, they don't see it as we have to save everybody. It's like everybody has a right to die, and and it's a really whole different philosophy. And the emergence of palliative care, I think, has started to help people become more comfortable with dying and the whole process of dying. But we really have to, everybody should have an advanced directive in advance that's an automatic part of what you have, that people know, your whole family knows what you want. You don't assume that we jump in. I think we're prompted by a lot of legal action that we jump in and do things as opposed to not doing things.
So if you were in the ER and that patient came in, you'd all treat them?
No, I don't know, I'd be really uncomfortable, but yeah, you have to actually, I think, yeah.
So.
No, I just read this book, and I think you read that, Being Mortal, which is about that very conversation and about having those tough talks that no one wants to have about what you really want at the end of your life and how you want to end that phase what's happening. I just thought it was a great book, but it was also very much like this. It's
How
just
uncomfortable. I mean, even I was laughing because as you were talking before, you didn't want to say die. You didn't want to say the word die. You didn't want to say, I was thinking, oh, she's one of those who, I'm uncomfortable saying, you are going to die. It's a really hard thing to tell
Well, let
somebody.
me put it this way, in my family, growing up, I knew exactly what my parents want. They talked about it for years, and when the time came, it was sad, but it was easy, because it was a matter of loving them and respecting their wishes. No extra anything. Let God, no, my mother would say, screw medical technology. It was very easy. But if someone, was rushed to your emergency room, I don't think you have a choice.
But let me ask you about this case, because what's interesting is he's only been diagnosed, she's only had symptoms for 3 months. Right. Huntington's disease usually will take
10 to
years,
20 years.
10 to 20 years before you're end state. So one question, is it ever rational for this, what's his name? John? No, bad choice. 32, I like that.
Yeah.
Is it ever rational for John to commit suicide?
Yes.
It's,
I mean, you're saying it may take 10 years, but suppose he knows he's gonna get irreversible dementia.
he
You don't wanna
knows.
go through that.
You don't know how long it's going to take either. 10 to 20, it could be 5.
It could be from 50 to 52 that he's demented.
Yeah, but who's gonna decide that? You were.
But that's his decision.
He's gonna get to a point he can't think for himself, which is what he's worried about.
But he's got time to go work it.
But no, even in Oregon, he would not be allowed to commit suicide right now. You have to be terminal. You have to be expected to die within 6 months. He's not terminal.
That's a,
Would you treat him any differently if he had enough pins in there versus if he did not have enough pins?
I'd like to take
If you had
offense
a
at the
what?
6 month
If you had
concept.
no pin in there.
Oh, right.
Well, that's,
I mean, if you're going to die within 6 months, there's a difference when you're going to be miserable at 9 months before you die. I mean, I could keep somebody alive for a really long time.
that's true.
You know, so
If he had an advance directive,
Is it really
standing or
advanced?
whatever, when we checked it from the emergency.
It's really nice to be terminal.
Where would that leave you?
An advance directive would not help him in this case. Even if he had a fully executed advance directive, I don't think at this point he could be, I mean, suicide is not considered, even though.
So,
But if he has an anti-resuscitation in writing legal.
But he's pumping your-
He's saying don't
If it's
resuscitate.
available,
But-
right? If they know what it is, if you come in as a
Yeah.
ER, completely unconscious.
No,
Pump
but,
his
Yeah, there's a
stomach,
whole different
exactly.
level of resuscitation.
but thinking, like thinking, here's a legal document. Does it really matter, what his situation is? And he tried to commit suicide? He says, I don't want to be resuscitated.
When people jump off the Golden Gate Bridge, we actually go get them. We don't let them
Don't
drown.
let them drown.
So in this book, here's Alice, there's still Alice. So the one, and when I saw, did anybody see the movie, here's that, still Alice? Okay, so the one time that everyone in the theater went, oh, you could hear, she has prepared a video for herself to say, I know I have Alzheimer's, there's gonna be a time when I can't make this decision, so she puts the bottle of pills in the drawer with a yellow tag on it, she has a video and says, if I ever get to a point in my life where I can't do these certain things, these tasks that I've written down here, then Alice, she tells herself on the video, you go upstairs to the second bedroom and go in the top drawer, and there are pills in the drawer with yellow tag. You take the pills, you swallow them, you lie down, and don't call anybody. So the Alzheimer's is bad enough that she can't remember the directions down when she's looking at the video, so she keeps replaying it, and she kind of has to carry the laptop upstairs and keep replaying it. She follows the directions, she gets the pills, I'm making this way too long. She gets the pills, she takes them in the bathroom, gets a glass of water, and she's ready to take the pills. And the door knock, the caregiver shows up, and she drops the pills on the floor. So she can't take them, and she can't commit suicide, she can't save herself from what she knows what's happening to her, and she's known all along what's happening to her, she can't do it. And the entire oxygen went out of the theater for that moment. Everyone was distressed that she had missed her opportunity to take her life successfully because he was aphasic already. She just couldn't even communicate. She lost so much of her life, of herself. So it's just very interesting how that's people want that choice. They don't wanna have this, if he watched the relatives suffer this, another 10, 20 years, give him up. I don't wanna go there in 10, 20 years. I can hear him saying that.
I mean, I think he has the right to make that choice, you know, I just don't think he did it the right way this time around. You know, and I think when, you know, a note pinned to his sweater, you know, from a doctor's point of view in the emergency room, you know, I just couldn't roll up at that one. Sorry, you know, I'm gonna have resuscitation for another day.
What if instead of just pinning a note saying what he had done, he actually pinned a DNR on there?
And signed it.
Huh?
And signed it.
Notarized?
No, I mean, if he had a DNR, a legal DNR document, and suppose he pinned that on himself and ended up in the emergency room, would you
Shouldn't come to the
ignore it?
emergency room.
That's what I
Would
said.
you
They
ignore
shouldn't
it?
come to the
Yeah, you
emergency
should.
room, yeah.
Well,
If he's unconscious.
but somebody
he's
takes
right.
him there. He doesn't go there.
Yeah.
Somebody takes him
Except
there.
this is where a conversation with your wife should have taken place.
Yeah.
And, yeah, and there should have been some understanding and love and respect on both sides for him to explain to her. So she knows this isn't just some, oh my God, you know, he's been drinking. I don't know if you even know what this is about. So that, yeah, back to yours, not the right time. Everyone should have been on the same page.
See, I think in a way what it's come to is that, this is gonna sound very cynical, but, not that I don't love doctors, I need doctors, I want doctors in my life, but in terms of end of life stuff, I think in some cases, and I watched this with my stepfather, doctors and the healthcare system are getting pitted against individual choice. I mean, do we or do we not have the right to our own life or lack thereof it? You know, you're taught in medical school, and I'm not a doctor, I don't know exactly what you're taught in medical school, but I know, you know, preservation of life. Well, why is that necessarily the highest good?
Read Being Mortal.
Yeah, I had a very different experience. I lost my grandmother, well, March of last year, and then my father in December of last year, and we had doctors who were calling it well before, you know, there were still steps to be taken for treatment, and said, well, you know, you really want to think about measuring the quality of life against what you're going to get out of this, you know, and I think doctors nowadays are, my experience, at least, and this is up in New England, I don't know, more progressive up there or something, but it's, no, I found a very different kind of culture of medical care up there, which was a little shocking to me at some point. I mean, but it really did force us to face up to where these family members were in their lives. My grandmother was 95 and certainly lived a very long life, and you know, but had just bought a car at age 90, was still driving herself to quilting class, and you know, she got a cold, got dehydrated, ended up in the hospital, and you know, a week later she was admitted to hospice, and a day later she was dead. And you know, my father had been suffering from congestive heart failure for years and years and years, and finally, you know, we worked through a whole bunch of scenarios where he finally just said, you know what, I just want to be home. I just want to be home. And the doctor said, he's ready for hospice. And so we brought in hospice, and you know, I think 2 weeks. Yeah, 3 weeks. So, you know, I think it's out there, and I understand. I hear you on this need to value life and everything, but the past year has changed the way, you know, I think I would have thought that very same thing a year ago, and had a very different experience in the past year.
I watched a guy, my stepfather went in with advance directive saying he wanted to die. He was vague, okay? And because there was dissonance in the room with the social workers and the doctors about what the other people wanted, they just scrapped the whole advance directive.
Oh, wow.
And they continued doing
That's
transferring
wrong.
from
That's
the
why I think
clinic
I
to
agree,
the
that's wrong.
wage back to the clinic with doctors and stuff hooked in him. I mean, it literally prolonged his very minimal existence of a life for like
a long time.
Yeah.
I mean, it was like, who's this for, you know?
Right.
I read that Being Mortal book about 4 months ago. I got it for Christmas, so that must have been 3 months ago. And Dad came down to visit late January. I just finished it. And we were pushing my 2-year-old in the swing. I said, Dad, I want to talk about the end of your life. He was like, what? I said, no, I want to know exactly what you want right now in terms. He's like, oh, fine, don't do anything. I was like, what does that mean? He's like, but don't put any tubes in me. I was like, no, what does that mean? And the issue is, what is vague, right? I mean, he's a smart guy, he's educated. He has no clue what happens in the ICU. I don't even know what happens in the ICU anymore. It was 7 years ago I was there. So this concept of what is vague and what you want is a really difficult slippery slope. Because, I mean, I can tell you what I want, and it's not even as good as what an ICU doc will tell you. And how does that mean any of us can write this document down well enough to respect our actual wishes without a doppelganger standing there being like, no, don't do that to my dying form? And this is a question I think you need to, I would like to write down for myself in this stage of my life, because I might leave here tonight and get hit by a car and need all these things, right? Yeah, I mean, so, and who knows? And it might be different when I'm almost 70.
So what's the solution? I mean, I'm right there with your dad. It's like, hey, this is a no-brainer. You know, just stop the tubes. And you go, oh no, you don't understand. The ICU, that's vague.
Yeah.
That's pretty straightforward to me.
I think the solution.
I want to understand what's going on in the ICU, so it ain't vague anymore.
I think every 10 years you should get a checkup with a lawyer who does that, and get a checkup for your advanced directives.
I would just suggest you think about one thing too, because when you were talking, it reminded me of this. You know, most doctors, obviously doctors who are operating, are fairly young. I mean, there aren't too many of them operating up in their 70s or 80s now. When people get older, they look at life a little differently. And I'm 85 years old. I hope to be around for a long time. But I look at life differently even now than I used to 10 years ago or when I thought about it. And I think doctors often don't understand older people. Older people get to a point where they've had a pretty long life and they know they're going to die someday. It's not as long in the future as it was before and all that. And so they may make decisions that are different rationally to them than somebody your age. And I don't think doctors take that into consideration.
I would argue. Well, first of all, can't believe you said that they should just go to a lawyer every 10 years. I'm a general internist, but
for someone to just discuss these things directly.
I know, but you should. I know there are not enough of them, but you should see your primary care doctor, and you should talk to them and sit down and tell them what your wishes are. I do that with patients all the time, and I do that all the time. I'm a primary care doctor, and I mean, you know, Jonathan talked about his death on a beach. I want to die in my sleep, but I don't want to have a minute in the ICU. I want to die in my sleep and not be a burden to any one of my family members, and that's how I want to go out. But I talk to people all the time, and I know you want your dignity, and I know that. And I know it's important to you to be around your family and your loved ones. So I can't believe you said that.
Well, I just don't know. I just want to make sure the paperwork's right. Like, I know.
No, actually, I don't.
Do you know how to do that?
I don't probably have enough of my patients have paperwork, but I know the right thing for them. And I know.
But what if you're not there? It has to be on that paperwork.
Well, that's like one of your patients goes to emergency room, and you call them. This is what my patients.
I'll come in and I'll go in and I'll say, but this is.
It'll be a colloquy.
If they do have a car accident and I'm not there, they're not.
I work in
there.
an ICU,
But, yeah.
and if a primary doctor comes in, that carries a lot of weight.
That does. I know the person and I know what they're thinking. So you should have a good primary care doctor. You should talk to them, and somebody who will sit down with you and talk to you and get your wishes.
You should see your primary care doctor every year, and then once every 10 years, a lawyer should come too. That's
the medical home, right? That's gonna have their lawyer.
Okay, 7:30 or a bit more, which is meetings are over our time. I mean, you guys have been fantastic. You can stay and talk. I recommend you stay and talk by the salmon and the wine, but that's up to you. These doctors are available, I think, for a while longer. And I want to take the privilege of my situation here to tell you that when I was pushing my grandchild in the swing, he had long blonde curls like his dad. And he said, "What do you want to do when you get older?" I said, "I don't care, man, I'm immortal."
It's the concept of hope, because we all think about that now, we're healthy. None of us have been in a serious car accident, and then with tubes, and then people say, "What do you want to do?"
I know.
Because then you're pulled up for hope.
But I do deal with people who go through that all the time. I deal with that all the time. So I have that perspective of somebody who's gone through their life and gone to that period. And so that's why you're really a good, primary care doctor makes
There's a good resource out there for, instead of welcome mats, DNR mats. In front of a lot of.
Thank you, folks.